Good afternoon, everyone. So I'm here to present my topic on changes in refractive error and corneal topographic following horizontal strabismus surgery. So I have no financial interest in this presentation. So strabismus surgery, as you all know, it is most commonly performed procedure is on the horizontal recti muscles, which is primarily aimed at restoring the potential vision of the patient and also in providing better cosmosis. However, even with the best surgical outcomes, patients still have visual disabilities. The pathophysiology behind this is when you are doing an horizontal strabismus surgery, you cause change in the insertions, which causes alteration in the tension of the recessed muscle, and that causes changes in the forces acting on the sclera, in turn causing an morphological changes in corneal curvature. So our objective was to compare the preoperative and postoperative refractive error changes by cycloplegic retinoscopy, and also to compare those values with corneal topographic changes using pentacam. So we had a sample size of 50 patients aged from 8 to 35 years who were diagnosed with concomitant exotropia or an esotropia and who underwent an unilateral horizontal strabismus surgery. We excluded all the patients who had any history of previous ocular surgery or any other intraocular pathology who required a vertical strabismus surgery and ocular trauma. So the pre-op evaluation included best corrected visual acuity, a thorough squint evaluation, both motor and sensory evaluation, a thorough cycloplegic refraction, anterior segment evaluation, and corneal topography was done using pentacam, and fundus evaluation, and they underwent strabismus surgery by a single operated surgeons, and they were followed up over a period of 6 months. So statistical analysis was done in SPSS software. A paired t-test was used to assess the preoperative and postoperative variables, and a p-value of less than 0.05 was considered significant. Coming to the results, among 50 patients, there were 32 males and 18 females, and 84% was operated for an exotropia and 16 for an esotropia. So among the population, 26% already had a pre-existing compound myopic astigmatism and 22% were emmetropes. So the mean preoperative and the postoperative visual acuity using logMAR chart revealed no difference in the visual acuity changes. The mean spherical power at pre-op was -1 diopter, and over a period of 6 months was -1.03 diopter, which showed a slight myopic shift. The mean cylindrical power was 0.6 in pre-op, and it became 0.73 in 6 months of follow-up, which also showed a myopic shift, but it was not significant. The average anterior corneal curvature, the mean was 44.67 at pre-op, and it was 45.01 at 6 months follow-up. It was in the normal range. The mean corneal thickness remained normal throughout the follow-up period. So coming to the discussion, the first study was done by Don Marshall, and he compared it with the operated and the non-operating eyes, and he identified that 60% of the squint operated eyes had astigmatic changes post-operatively. So next came Preslin. He also did the same study, and he proved that there is no significant change in the spherical equivalent. However, there was a temporary change in the astigmatic power at 180-degree meridian axis. There were other studies done by a lot of authors, and the literature says that there is a transient astigmatic change which is seen over a period of 6 weeks to 3 months, which settles over a period of 6 months. Corneal topographic changes was again done by Nardi et al., and he also proved that there is an increased astigmatic power at day 1 of post-op, which was reduced by 1 month. So to conclude, yes, horizontal strabismus surgery may cause a transient myopic shift and increased with the rule astigmatism, but the magnitude and surgical technique do not affect any of these findings. The refractive changes in the strabismus surgeries are usually insignificant. So as an ophthalmologist, we should be aware of this preoperative things and postoperative changes which can happen, and we should counsel the patients and give them reassurance that whatever change is going to happen is only transient. And anyways, they can undergo any of the other corneal procedures safely even after a strabismus surgery. Thank you.
Very good. Yeah, it's only transient changes.
Yes, sir.
I don't find any permanent changes.
Yes, sir.
Yeah. Okay, Amma, thank you. Thank you for the presentation.